Welcome to today's exploration of hypercalciuria, a condition affecting the urinary system. We'll delve into what it is, why it happens, how it manifests, and what we can do about it. Join us as we uncover the intricacies of this often overlooked medical condition. Hypercalciuria at its core is defined by elevated levels of calcium in the urine. The underlying causes can be multifaceted. In some cases, it stems from increased absorption of calcium from the intestines, perhaps due to an overabundance of vitamin D. Other times, the kidneys themselves might be the culprit, failing to properly reabsorb calcium back into the bloodstream, leading to excessive excretion in urine. Additionally, certain medications like diuretics and conditions like hyperparathyroidism, where the parathyroid glands produce too much parathyroid hormone, can disrupt calcium balance and contribute to hypercalciuria. In rare cases, genetic predisposition can also play a role. Let's explore the pathophysiology of hypercalciuria. Normally, our kidneys meticulously filter blood, reclaiming essential substances, including calcium, and returning them to circulation. In hypercalciuria, this process goes awry. Either the kidneys fail to reabsorb sufficient calcium after filtration, or there's an overload of calcium being present to the kidneys in the first place. This excess calcium in the urine can then lead to the formation of calcium-based kidney stones, microscopic deposits in the kidney tissue called nephrocalcinosis, and other urinary tract problems. This disruption of calcium homeostasis can also impact bone health over time, potentially leading to decreased bone density. The exact prevalence of hypercalciuria is difficult to pinpoint, as many individuals may be asymptomatic and undiagnosed. However, it is recognized as a significant risk factor for kidney stone formation. It is found more frequently in individuals with a family history of kidney stones, and some studies suggest that hypercalciuria may be present in as much as 50 to 70% of people who form calcium oxalate stones. While it affects both genders and all age groups, certain underlying conditions, such as hyperparathyroidism, can increase the likelihood of developing the condition. Furthermore, geographical location and dietary habits can also influence the prevalence due to their impact on calcium intake and vitamin D levels. The signs and symptoms of hypercalciuria can vary greatly. Many individuals experience no noticeable symptoms at all. However, when symptoms do appear, they often revolve around kidney stone formation. This can manifest as intense flank pain, known as renal colic, radiating from the back to the groin. Other symptoms may include blood in the urine, hematuria, frequent urination, painful urination, and nausea or vomiting. In children, hypercalciuria may present with vague abdominal pain, failure to thrive, or recurrent urinary tract infections. Diagnosing hypercalciuria typically involves a 24-hour urine collection to measure the amount of calcium excreted. This test helps determine if calcium levels are abnormally high. Blood tests are also commonly performed to assess kidney function, calcium levels in the blood, and parathyroid hormone levels. Additional tests, such as imaging studies like X-rays or CT scans, may be conducted to detect the presence of kidney stones or other abnormalities within the urinary tract. It's important to note that diagnosis should be made by a qualified healthcare professional who can interpret the test results in the context of an individual's medical history and other findings. While there aren't strict types of hypercalciuria in the traditional sense, it can be classified based on the underlying cause. Absorptive hypercalciuria arises from increased calcium absorption in the intestines. Renal hypercalciuria occurs when the kidneys fail to reabsorb calcium properly. Resorptive hypercalciuria, less common, is associated with increased bone breakdown, leading to elevated calcium in the blood and subsequent excretion in the urine. Identifying the specific underlying cause is crucial for tailoring treatment strategies. Treatment for hypercalciuria aims to reduce calcium levels in the urine and prevent complications like kidney stones. Dietary modifications are often the first line of defense. This includes limiting sodium and animal protein intake, which can increase calcium excretion. Paradoxically, restricting calcium intake is generally not recommended, as it can lead to increased oxalate absorption, potentially worsening kidney stone formation. Adequate fluid intake is essential to elute the urine and reduce the risk of stone formation. Medications, such as thiazide diuretics, can help the kidneys reabsorb more calcium. In cases where hyperparathyroidism is the underlying cause, surgical removal of the affected parathyroid gland may be necessary. Preventing hypercalciuria primarily focuses on adopting healthy lifestyle habits. Maintaining adequate hydration by drinking plenty of water throughout the day is crucial. Limiting sodium and animal protein consumption can also help. A balanced diet with sufficient calcium, as recommended by a healthcare professional, is important. Regular exercise and maintaining a healthy weight are also beneficial. Individuals with a family history of kidney stones or hypercalciuria should discuss their risk factors with their doctor and consider periodic urine testing. The prognosis for individuals with hypercalciuria is generally good, especially when the condition is diagnosed and managed effectively. With appropriate treatment and lifestyle modifications, the risk of kidney stone formation and other complications can be significantly reduced. Recent research is exploring new therapeutic targets for hypercalciuria, including medications that specifically address the underlying mechanisms of calcium dysregulation. Genetic studies are also underway to identify genes that may predispose individuals to the condition, potentially paving the way for more personalized prevention and treatment strategies. It's important to stay informed about the latest advancements in hypercalciuria management by consulting with your healthcare provider.